Hey everyone, it is Kevin Henry, the editor-in-chief for drbycuspid.com. Thrilled to be back on another episode of the drbycuspid.com podcast. This is one of those we're going to keep short and sweet because I really want you to go back and read the article this amazing lady wrote, and that is Kim McCleskey. Kim, how are you?
I'm doing great. How are you doing, Kevin?
I am good. I always love talking to you, and I always love having you contribute to Dr. Bicuspid. And the article that you wrote recently on embezzlement, and we're going to link to that in the show notes. But if you don't happen to see those show notes, just go to drbicuspid.com and search for Kim McCleskey, McCleskey, and you will find her article on embezzlement. And I always love to pick your brain about one certain point of your article. And this time I really, what jumped out to me was you were giving tips on how to make sure that embezzlement doesn't happen in the practice. And I loved one of the things that you mentioned, and I think it's so common in dental practice, is that you mentioned the over-reliance on a single employee to deal with the finances and how that can often be, that little crack in the door that can be kicked open
hmm
and possibly embezzlement can come whenever there's just one person that kind of oversees everything. So I got to ask you, what do busy dentists do whenever they're relying on that one person to kind of be their money go-to in your mind?
Yeah, I mean, it's such a great uh, you know discussion topic for one thing, right? Because there's lots of hurdles when you only have one person
Yeah.
in the office that's your main go-to, right? They're the face of the office. Sometimes that person is turning over rooms and confirming appointments, right next to each other. They're taking in money over the counter. They're making the bank deposits. They're just responsible for a lot. And sometimes, that seems like, we're going to keep overhead down that way. We've got this one person who can do all of it, but it's just not wise for a lot of reasons. It's just not wise. And, it's difficult to find the workaround, quite honestly, right? Because
Yeah.
you've kind of operated like that for quite some time, and it seems to be working. But I think the best and probably the safest way to keep transparency is for the doctor to be involved in those processes, those financial aspects of that money coming in over the counter or any EFTs going in. The doctor has got to be involved. And whether that's, just looking at the day sheet, making sure that, all the deposits are calculated properly, that making sure that treatment was done right, just having that oversight, and then being the one to take the money to the bank. That would be a really simple way of just communicating, hey, we're working on this together. We both have eyes on it.
Yeah.
Um, yeah, I mean, I think that's a pretty simple first step to take.
And one thing that sticks out to me, and you mentioned it a moment ago, is that relationship that there often is in the practice, especially in today's staffing shortages and the things that are going on
Yep.
there. And a dentist may be listening to this and say, "Oh, this person's been working for me for 25, 30 years, like family." And yet
Yep.
you and I have both heard those cases where a longtime employee has gained that trust, and sometimes whenever hard economic times hit, that's whenever it's
Yeah.
easy to make things happen.
Yeah, that's exactly an example, like almost verbatim, an example that I have. Trusted employee, had a credit card, made purchases. It was a satellite office also, and so the doctor wasn't in that office. There were associates and employees and all that this office manager was overseeing. And she once she was caught, she said, I was just going to do it one time. I was just in a really, hard spot, single mom, two kids. And then it was easy. And then it just became like, you know, she was paying for her nails and her hair and her cell phone and, all those things. And the way that she was hiding it, like it just became, because there was no oversight, it just became easy for her.
Yeah.
And and uh and she didn't feel good about it, obviously. She was humiliated, right? Like she was in a hard spot, like you said. Economic times, all of those things played a part in what she chose to do.
Well, we're going to make sure to link this article that Kim wrote that we just posted on drbicuspid.com. It's called Tips for Recognizing and Preventing Embezzlement in Your Dental Practice. I know looking at the statistics on this article, quite a few of you have already read it, but we want to make sure that it is available because we don't want your practice to fall victim to any embezzlement. And Kim, I really appreciate you as always, not just writing for us, but writing an important topic like this. Thank you so much.
Thanks for having me, Kevin.
Absolutely. And hey, before you go, I want to make sure, how do people get a hold of you? Because you know as well as I do, embezzlement always brings up those questions, as well as I know you've really got your finger on the pulse whenever it comes to what's going on with DSOs right now as well.
Yeah, for sure. So you can reach me at kim@professionaltransition.com. You can find me on LinkedIn as well.
All right. And again, we'll make sure that all that's in the show notes. Kim, have a good rest of the day. I appreciate you, my friend.
Thanks a lot, Kevin.
And thanks to all of you for listening to this quick episode of the drbycuspid.com podcast. I want to make sure that you see this article and that it's a part of your reading for today and making sure that you keep your practice finances safe.